Have you been feeling more tired lately, even after a full night's sleep? Maybe your stomach just doesn't feel quite right, or you keep telling yourself you'll start eating healthier next week. Most of us brush these things off because they seem so ordinary. But what if your liver has been trying to get your attention all along? In this video, we'll go over some of the most common warning signs of fatty liver disease, explain why they happen, and most importantly, talk about simple research-backed steps you can take to help improve your liver health if you're diagnosed early. Here's something that might surprise you. According to a 2023 review in The Lancet Gastroenterology and Hepatology, roughly 1 out of every 3 adults around the world has fatty liver disease. The scary part is that most people don't realize it because the disease can quietly develop for years without causing noticeable symptoms. Your liver is incredibly resilient. It can keep doing its job even while fat slowly builds up inside it. That's why it's important to recognize the warning signs before the damage becomes more serious. The first sign is feeling tired all the time, not the kind of tired that disappears after your morning coffee. We're talking about the kind where you wake up exhausted, struggle to get through the afternoon, and feel like your energy never fully comes back. Researchers have found that ongoing fatigue is one of the most commonly reported symptoms in people with fatty liver disease. While fatigue can have many causes, it's worth paying attention if it becomes your new normal. Another sign is a dull ache or pressure on the upper right side of your abdomen. Think about the last time you felt an odd discomfort under your ribs on the right side. Maybe it wasn't painful enough to worry you, so you ignored it. That's exactly what many people do. As fat builds up and the liver becomes enlarged, some people begin noticing a feeling of fullness or mild discomfort in that area. Next, pay attention to changes in your waistline. Even if your overall weight hasn't changed much, carrying extra fat around your abdomen is one of the strongest risk factors for non-alcoholic fatty liver disease. In fact, studies consistently show that excess belly fat is more closely linked to fatty liver than body weight alone. Now, take a close look at your skin too. Dark velvety patches around your neck, under your arms, or in other skin folds can be a sign of insulin resistance. This skin condition, called acanthosis nigricans, is commonly associated with metabolic problems that often go hand in hand with fatty liver disease. And here's the most important thing to remember. You may have no symptoms at all. That's what makes fatty liver disease so tricky. According to the American Liver Foundation and clinical guidance from the American Association for the Study of Liver Diseases, fatty liver disease often causes few or no symptoms in its early stages. As a result, many people only find out they have it after routine blood tests show elevated liver enzymes or an ultrasound performed for an unrelated health concern reveals fat in the liver. If you have risk factors like being overweight, type 2 diabetes, high cholesterol, high blood pressure, or you regularly drink alcohol, it's worth talking to your healthcare provider about whether your liver should be checked. The encouraging news is that fatty liver disease is often reversible, especially in its early stages. Research shows that losing just 5 to 10% of your body weight can significantly reduce liver fat. Eating more whole foods, cutting back on sugary drinks and processed foods, exercising regularly, limiting alcohol, and managing conditions like diabetes or high cholesterol can all help your liver heal and function more effectively. Your liver works for you every single day without asking for much in return. The least we can do is listen when it starts sending us warning signs. If this video helped you, make sure to subscribe for more evidence-based health videos that make complex medical topics simple and easy to understand.